I think in all honesty, it's very likely that we are going to have an impact within Australia and within the aged care sector, and we do need to make sure that we are prepared. I think we're concerned but not alarmed. I think it's really important to make sure that we're balanced. We have a plan. We have a plan that we really look at saying what are the areas that we need to focus on and who's responsible for doing what. That's a really important part of the plan, otherwise very quickly you can end up in a panic where everybody's working at cross purposes. So we have a plan. Within that plan, we're focusing on what levels of stock we have first and foremost, focusing on what areas of training we need to reinforce with both our staff and the people who might be coming to visit our services, focusing on where we get our information from, so paying close attention to the information coming out from the Commonwealth Department of Health, and then focusing on who and how we're going to coordinate with, so local public health units, local state health services, in the event that we do actually end up having an outbreak. The key is really, it's around education and it's around basic hygiene practices that we all know are important but sometimes forget. We do need to make sure that if people are not well, that they refrain from visiting, and I know that that can be hard. I don't think it's going to be easy, and I think the reason why there's a concern at a heightened level, I think, for people in aged care is that they are ultimately the people who are the most vulnerable and who do have probably not the same immune resilience as those of us in, the general population. So we do have to be a little bit extra cautious about what we bring into aged care services.